Peach County EMS is placing AEDs in public places throughout the county. Deputy Director Chad Davis says they're focusing on high-impact areas where large crowds gather. Carmen Brown spoke to their recipients about how this initiative could save more lives when every minute counts before first responders arrive.
The American Heart Association says 90% of cardiac arrest victims that receive a shock from an AED in the first minute live. That's why Peach County EMS wants to make them more accessible to the public.
A device will go in both North and South Peach parks.
There's always the risk of, particularly like in football, where somebody gets hit and then goes into cardiac arrest, or gets hit in the center of the chest with a baseball, and that's always a possibility.
Bruce Mackey is the director of the Peach County Parks and Recreation Department. He's all for the additional life-saving resources in the parks. He says for him, the reason is personal.
30 years ago, I was very fortunate to have personnel readily available to offer first aid to me. Had a cardiac arrest at a wrestling tournament.
One will also be equipped in Fort Valley Senior Center, where Imogene Mobley says her seniors like to play a mean game of pickleball and cornhole.
As we do have seniors who have heart conditions, heart problems, and so this will be a very viable program, for them to have it here at the center.
Davis says when emergency trucks are available, it usually takes their team 8 to 10 minutes to respond. So he encourages everyone to use an AED when someone nearby is experiencing sudden signs of cardiac arrest.
Nationally, it's 7.8% of cardiac arrests will come out of the hospital able to return to their previous life. We have a goal of hitting 10% in Peach County.
Davis says all 3 AEDs should be installed later this year. In Peach County, Carmen Brown, 13 WMAZ News.
Davis says they're applying for more funding to expand their AED program. They're also working toward a goal of training 20% of the county in CPR. That's about 1 in 5 people who would be equipped to save a life.